Hi, everybody. This is Kara with Senior and Disability Services, and I'd like to welcome you to our webinar, which is actually our public meeting to seek stakeholder input on the American Rescue Act funding. I'd like to give a few pointers here to get the most out of your webinar. This is a go-to webinar. It's a lot like a Zoom. It is a little bit different. You, as an attendee, have the ability to see us on your computer screen or your device screen. Could be a laptop, could be a phone, smartphone, or a desktop computer or tablet. You can also hear us through your audio. You could possibly be using your telephone for audio or your device itself. You are here in a muted state when people come into a GoToWebinar. You're automatically muted, and you will not be able to share your camera either. And it works pretty well for nice big meetings like this because it helps to free up our bandwidth and keep our audio lines nice and clear for everybody. And the way that you want to interact with us today is you would want to use the questions or chat area to interact with us, and you can do this throughout the session. It's a text chat feature. So if everybody would take a look at your control panel, you probably have a few icons. One of them might look like a little hand with a circle around it. Another one is a square or rectangle with an arrow, which you can open up your controls. You should see one that says questions or chat. If you want to go ahead and type something into that, give it a little bit of a practice and let me know that you can see that. And go ahead and say hello to us in the chat area, if you would. Okay, great. I see people participating. And what we can see here is we can see your chat. And please know that your questions are always welcome. We encourage you to write in your questions here. We will have time for Q&A. There may be duplicate questions. It's helpful to get your questions, whether you've heard someone else ask them already or not. If you wish to enter them, it's all good information for us. So we really appreciate using the chat there. So we can always keep your questions on record as well. Okay, so our session today will be recorded, and so you'll have the capability to view the recording. Just keep an eye on e-alerts for where it will be, and you'll be able to review the material later in that way. If for some reason our session gets interrupted because of an internet burp or something and you see us disappear, don't worry, it's extremely rare. We haven't had that happen yet, not for a very long time. But if you see us disappear, please don't leave the session. Stay in the session for at least 5 minutes. Let us regain connection and come back in. Same thing for you. If you lose your audio or if you lose the visual, it could be that there was a burp in the internet, and all you'll need to do is just exit the session, go back to your original link. Once you have connectivity, just go back to your email, get your link, and just come right back in, and we'll be here for you. Okay? So that's just about it on housekeeping right now. I'd like to go ahead and pass the presentation to Tony Newman. And go ahead, take it away, Tony. Thank you.
Thanks, Kara, and thanks everyone for being here. I'm Tony Newman. I'm the Deputy Director here at Senior and Disability Services, and I'm here for, on behalf of John Lee, our Director. He couldn't be here. He got called into a last-minute legislative hearing that was a can't-miss thing. But this is a very exciting day for Senior Disability Services. It's been months in the works to get before you today with our plans for our American Rescue Plan Act funding. And I just wanted to say that I just wanted to pass it over to Lynn, who's going to be our primary presenter right now. Most of you know Lynn Kyleman Cruz, our Chief of Quality. She has, I don't know if she volunteered or was asked to take this on, but this is a heavy lift and complicated to get to today. I think she's going to present a very clear plan and solicit your input. Lynn values public input very much. I believe, Lynn, the idea that we hold this webinar was your idea. So I just wanted to say an extra special thank you to you for the work you've done getting us here today. And with that, I'm going to turn it over to you.
And right away, I mess up because I'm muted. Thank you, Tony. I would say that I don't know what got into me, but I did volunteer to do this project because I recognize the incredible need that we have to do this and to do it quickly. So thank you for that. I think initially I want to say thanks for coming and let's get started. I have a few photos in here and I'll just give the credit to my husband right away. They're free to me, so here we go. So what I hope to be able to share with you today are the expected outcomes of this meeting. I hope that you'll gain some understanding of the intent of the funds, which is really important, and that you'll also understand the value and the limitations that we have in implementing. I'll try to go through those as I stumble upon them so that you understand what we can change and what we cannot change. We also, I have a bunch of proposed process in here and want to bring your attention to those details and also ask you to be sort of open-minded with the dates, but also I would really like feedback on the dates that we have in here, and have an opportunity at the end to ask questions. You'll notice when I say dates that we have some very tight timelines in here. Some of these dates are flexible, some are not, but we would love you to pay close attention to those because we understand about getting the money out quickly, but we also want to be very transparent that our bandwidth here is, we struggle with sometimes. So working together as partners will be really key in putting this together so that it benefits the workforce, it's structured soundly, and that will be easily justified and supported during an audit at the end of the process. That's important to you and also to the state. So let's just dive right in. So an overview of the projects. We actually have 3 projects under this analysis or under our spending plan. We originally had more. We heard loud and clear from everyone that the projects that we had didn't quite target the relief that needed to be happening for the workforce. And so we pulled back and reorganized and submitted these 3 particular projects. The first one is the critical incident reporting, trending, and analysis, which is really designed to assist the state in ensuring health and safety for individuals in our programs by identifying unreported and underreported incidents, but also trending and analyzing data that is ingested from our central intake system and also from the Medicaid Management Information System into a software that will be able to ingest that data and give us outcomes. That'll be important for a number of reasons, and I won't go into the detail of all of those reasons today because that's not the focus of this meeting. The second portion of this particular training is focused on the direct support professional certification and training. So there'll be a brief pause in between this session and the next one, but I will let Tony lead on that one and don't want to give you any spoilers, so I'll just shut up about that one. The whole focus today for us is this direct support professional incentive fund. So just want to make sure that you have an idea of where we're at and how we came up with these projects. So under these projects, we have a lot of state requirements. One is that under the American Rescue Plan Act of 2021, Section 9817. We received a state Medicaid's director's letter in May of 2021. And it's where states were permitted to send a plan to the Centers for Medicare and Medicaid, CMS, for spending an additional 10% FMAP savings accrued during the eligible period. So the federal government set an eligible period from April 1st of 2021 through March 31st of 2022. During that time, we'll be able to essentially save 10%. So the FMAP stands for the Federal Medical Assistance Percentage, which is like the federal share of Medicaid dollars that we spend. We will have a reduction of 10% of that. So our state share will be reduced by 10%. And we're allowed to fund these projects with that 10% savings and put it back into these projects that have to be approved under the Section 9817. So that sort of gives you the overview of how we came up with a spending plan. And then each quarter, we're supposed to submit a report to CMS about our activities under this plan. So as I mentioned before, the base period of the claims calculations is April 1st, 2021 through March 31st, 2022. This is a base period we cannot change. This is federally dictated. So this isn't one of the dates or one of the numbers that I'm asking for input on because we cannot change this. Just want to be really clear about that. So I'm going to go over, we also have to come up with a process for implementing these activities, and then also an audit and documentation trail at the end, because the federal government, when they give us money to hand out to you, they also want us to have an audit trail. So these are all part of the process that I'm going to show you today, give you an overview of today. So another cute picture of a bear sleeping my husband took at Katmai. So it's an adorable napping bear. Unfortunately, in the past 3 years, our workforce couldn't be this napping bear. We have had no time to nap, any of us. We recognize that and heard our communities loud and clear that our direct service or support professionals were hurting, that our agencies were hurting, and that it was very difficult to find staff, retain staff, support staff, which is why we've chosen to do this today. As I review this, I would really like you to keep in mind that base period. So that's really important when I talk about the base period, that's that 1 year period. And we will be reimbursing expenses looking back. And so when I speak about retrospectively, we're looking at that base period year of a retrospective allocation payment. We believe we will have around $22 million to spend on the project. We're still doing the calculations behind the scenes because the year just ended. But I believe that many of you have already invested in your workforce and have gone to great lengths to keep DSPs working, so the reimbursements will be welcomed and hopefully will allow you to reinvest in the workforce. So that's the real intent of this project, is that if we reimburse you retrospectively for payments you've made and incentives you've already provided, that then you'll be able to actually take that money, hopefully, and reinvest again in the future. And we would consider then also any remaining funds in here, or funds that went unspent, to roll over into a prospective payment, meaning from the end, from April 1st, 2022 through to March 31st of 2023, that would be a prospective payment, and we would recalculate what we don't spend looking back to invest in going forward. And I'll try to explain that really well when we get into some of the more kind of complicated slides that don't have a pretty sleeping bear, and hopefully give you lots of time for questions at the end. See here. So eligibility to participate. Who's eligible to participate? These are the big burning questions, I think. So you have to meet all 4 of these requirements to be able to participate. You have to be certified as a home and community-based services waiver provider. You have to be enrolled in Medicaid, and that's what we call active, when you're certified and enrolled. And you have to be certified and enrolled during the base period between April 1st, 2021 and 3/31/2022. I hate to keep repeating that, but I had to repeat it to myself a zillion times before I actually got it. So I'm going to keep repeating it. So you have to be certified. And then you have to have had paid claims during that base period for the types of services delivered by DSPs as identified in Table A. And I'm going to show you Table A right now. So one question I've already had is whether personal care and community first choice is included in the eligible categories. As you can see, they are not. We have only considered certified home and community-based providers as eligible for this particular project. But I will point out to you some ways that we can be flexible, or you can be flexible with that. The reason we did that is the state really determined that home and community-based waiver services are provided to individuals with a higher level of care, and it makes it extremely difficult, especially during the pandemic, to staff some of those placements and some of those people, and they were one of the hardest hit. So we targeted those services as our priority for this project. We have a very finite amount of money. To some people, $22 million seems like a lot of money, but when you distribute that across 400, 500, 600 providers, it's not a lot of money. And so we tried to really sort of limit that down so that we could make an impact in our workforce in some way. And we don't want to make light of the services under personal care or community first choice. But with that finite amount of money to invest, it just seemed like an easier decision, not easier, wasn't easy decision, a more logical decision to limit it to HCBS providers for now. So the other thing I would point out is that if personal care agencies are also certified for waiver services, they would be eligible under those waiver services. And I will explain that a little bit more as we get into the bigger slides. So this is Table A. So I will refer to Table A as well. Table A, as you can see from this list, we've eliminated some services like meals, transportation, nursing oversight and care management. Instead, focusing on these particular areas, and this is where we think, based on feedback we've received and from seeing what services get utilized, that this is where we were the hardest hit during the pandemic. So if we focus on these particular services to reinvest or reimburse, then that reimbursement might be invested in other areas. That's the part I'll try to explain later. So for instance, here, if you were a large meal provider, but you also provide respite, your allocation that I'll talk about is going to be based on your respite services, not on your meal services, because that's not part of this group. I'm going to go on to the reimbursement types. So this list was included in the spending plan to CMS. I personally added the vaccine incentives paid to DSPs, because I heard from many of you that those were offered. You did that because you thought it was the right thing to do and you were trying to get folks vaccinated. Those are all eligible, should be eligible expenses. I'm not worried about bringing those forward in this plan. That being said, I'm not a provider, not right now, and I don't know all of the areas, and I don't think, as we were putting together this plan, we tried to think of all of the areas when we pitched this to CMS, but this is the area I think we would really appreciate feedback on, because we put something very vague in our plan that said we'll consider other possibilities, but this is an area when I show you what we're going to do, where we really need to lock down what types of expenses we will consider as reimbursable. One of the reasons is that we, whoops, I'm sorry, I skipped over. One of the reasons is that we really want to be able to be transparent about what we are considering as an eligible reimbursement or an eligible expense. So there are actually 3 reasons for this. So we don't have the bandwidth at SDS for a complicated review of other types of suggestions while we're in the middle of processing forms. It just doesn't, sorry, I did turn my phone off there. It just does not, it wouldn't be a process that we could accommodate. And so what we're asking for is that you provide that ahead of time before we finalize the forms. We also want a fair and transparent process so all providers are able to see the defined process prior to submitting expenses. We want a level playing field for providers to be able to submit expenses. We also want to make sure that we get a payment out as quickly as possible. We've heard from a lot of people that you really want the payments as quickly as possible. We're working on that as fast and furious as we can. And so another reason that we really want a defined, clear list and clear practice for doing this. So the next step is how do we calculate the allocation that each provider would get? So it isn't really a complicated process. It's formulas on a spreadsheet that, that we figured out. But for transparency, I've included words that I'll go through. I've also included some examples so that we could walk through scenarios that might be on your minds as we process this. And my hope really is to have all of this written into a process policy prior to full implementation as well. And so you would have that process, you'd have the forms, and you'll hopefully understand how your allocation is created. So the first part is the allocation amount is based on the percentage of the total service claims in the base period, and it is for that all those services that were paid in Table A. So we're gonna pull a report for all of those specific services in Table A, and we will have it by provider type for anybody that had paid claims during that base period. And then it'll give us your total, and the total amount at the bottom of that report will be all providers' total claims together. Then we get the percentage of the allocation by dividing the provider, their total, by the total number of paid claims. And that'll give you a percentage point. And then we take that percentage, we multiply it by the total 10% FMAP available. So let's say Lynn's place, which is an example I will show you, she has a percentage of 0.0652. At the end, we would multiply that by 22 million if that's the total FMAP available, and Lynn would get that percentage amount allocated towards her to cover reimbursement of expenses. The one thing I will point out repeatedly, hopefully throughout this process, the allocation isn't a grant. It isn't money to just be spent. You actually have to have eligible expenses to qualify to be reimbursed for this. And then we would have the first allocation amount per provider. So those are very wordy descriptions. Let me also show you maybe hard to read table. I hope not. So I've come up with some very creative names here of our leadership team. And each provider's claims, like I said, are the total of that table A for the base period. And you'll see in C, column C, are the individual amounts for each of those homes. The total at the bottom, this is C8, is the amount. So we would take Lynn's place. She had $75,887.13 worth of paid claims in that reported period. We would divide that amount by this amount, and we would get her percentage points, her percentage of the total. And then we multiply it by the available. So I put $252,000 in here as an example. That's the total sum of the 10% FMAP. And her first allocation would be $6,758.92. So that's fairly simple math. And once we get these allocation amounts, we would notice providers that the first allocation, you're an eligible provider according to our records. Here's the first allocation amount, and we would give you a link to the application, the forms, and the process. And we'll talk about timelines in a minute. But that's how we would calculate the first allocation. So how do you apply to participate in this particular project? First of all, each enrolled and certified Medicaid provider will submit an attestation form that will include, some of these elements. The really important thing I want to note here, we discovered this when we did the CARES Act funding, and healthcare services, our partners, have helped me deliver this process. One of the things they encountered was that the person that wanted to sign the forms wasn't the person authorized to do business. So we need to make sure we are going to process these through the Medicaid Management Information System, MMIS. So it's really important to us and to you that the person that is authorized to conduct business for each agency is the person that is signing that attestation form, because we want to know the person that is responsible is responsible. So that's one of the things. So an attestation form will be needed. The second is an application form, and the application form, I haven't created the whole thing yet. I'm still working on it, but it will be basically the same, a couple of things that will tell us who you are, and then the summaries per quarter of eligible expenses. So we'll have, it'll have each quarter listed out for that base period, and you would submit your expenses for that. I'm not tracking down to what exactly your expenses are. I'm leaving that to provider agencies, or we are leaving that to provider agencies. But I will tell you, there will be audits afterwards, and we do have to make sure. That's why I want those categories very clear and defined, so that providers have the ability to track it and are very thoughtful in how they're recording that documentation. And I'm open to feedback on this, because I'm hoping that that would be a fairly simple process based on how people code in their own systems. Each Medicaid ID enrollment number must use a separate attestation and application form. So a provider would forfeit their eligibility if either of the form is missing. This 6/17 deadline, that's the one we need to really talk about. So that I put in there, that's a very aggressive timeline considering we probably won't get our forms finalized until close to the end of May. We do hope to have another planned webinar at the end of May to give you instruction, but it's still a very tight turnaround. And so those are the types of things that I think we need to get feedback on, especially. We're trying to be as fast as we can possibly be, but I don't know if it's too fast for you or not fast enough. You'll need to let us know that. The other part is we, for audit purposes and for us for tracking purposes, decided that we really needed to go with each individualized Medicaid enrollment number because we need to keep it separate. And I hope that's not a problem, but that's what we decided to do. So the other very thing I'll preface here, put big stars by, providers that had no eligible expenses during the base period. I doubt if that is going to happen because I think you as providers have really invested in your folks and will have expenses. But let's for the sake of example say you had zero eligible expenses because you were strapped or in order to be considered for the prospective period, we have to be able to roll unused funds over into the next allocation. And so for us to be able to do that, we need to know who's going to participate and who thinks that they're going to have, maybe they didn't have money to spend back here, but now that they know they're going to be reimbursed for some things, they might want to spend going forward. That's really important for us to know and to be able to track. And so we have to know if you're in or you're out so that we can reallocate. We want the money to be spent and we want it to go out into the workforce. And so part of why I think it's really important for this is because I think it's important for all of you to have access to those funds. And remember, well, I shouldn't say remember because I haven't said this yet, but our funding is time limited. So we have to be able to expend all of the money. Originally, it was by April 1st or March 31st of 2024. I just received word they might extend that a little bit. We don't have official word yet. So I just want to make it very clear we have very short timeline in the world of spending to expend this money. So that's another reason that we need to know who's in, who's out, so we can reallocate the funds. This is an example that I wanted to show you of how we will track the expenses. One of the things I wanted to show you is Caroline's Irish Care. Caroline, she billed a lot. She was the highest biller of paid claims during that base period, and she had the highest percentage, but yet she didn't spend any. If you look in her eligible expenses, she spent no money on her workforce. Maybe she couldn't. And so her $147,000 is going to be available to her if she submits the application and attestation form. We'll see how responsive she is in the next example. And you can see LeBron's Classic. I'm going to use those two as my example. He didn't submit any money either. Everyone else did. And you can see under Lynn's, if you look at line F here, this was her allocation amount, her first allocation amount, but these are her expenses. She didn't spend the whole entire amount. And so she has a balance of $1,800 left. That will roll forward for her. So you as providers, if you don't spend all of that, all of the first allocation, and you don't have eligible expenses, that money will at least be there to roll forward. If we have money that's unused or unspent, we will redistribute it with providers, and I'll show you how that would happen. So that number would go up for Lynn's place. So getting to approval, how do I envision this process working? It is, again, has some dates in there that are very, very aggressive. So I'll just tell you that right now. So the provider entity submits has to have the authorized MMIS user on the signature lines. So if that has changed for you, you don't have updated records, please get in there and do that work now. The other part is when we go to provide a payment at the end where healthcare services is going to issue the check through MMIS. If you have a debit transaction, that's how you're getting the money. If you get a paper check to 230 West 85th Street, that's where you're getting the money. We won't accept changes. It's what's ever in the MMIS as your payer path. That's a bad word, or a bad analogy. However you're going to receive your money, that in MMIS, that is how you're going to receive this money. You would put all of your qualifying expenses by quarter on the application. You submit both, even if you don't have qualifying expenses in the base period, if you want to participate, and you submit those to SDS. SDS is going to check to make sure you have active credentials. If at any point a provider is inactive, we will not make payment to an inactive provider because that defeats the purpose. So say someone was active through the whole entire base period, but then they become inactive prior to us sending the check out. Well, then they're not going to reinvest in the DSP workforce. So we feel justified in saying we wouldn't make payment to anyone inactive. We would then redistribute that to other active providers. SDS would make the determination. We'd enter information into a notice and we'd tell you. So say, for instance, you submitted an expense and you added in another category and you said you bought lunch for everyone at your agency, or I'm trying to think of an example. If we knew that information, we would deny it and you would get the balance of whatever it was without lunch for your whole entire organization. And we would issue that over to healthcare services. We would notice you to say, we're deducting the $200 you spent on pizza. That's a bad example, but it's the only one I can think of. And we would submit that to healthcare services for payment minus that $200. Again, when healthcare services goes to issue the check, they are going to check for active credentials because they won't pay as well. Our timelines are here. We're trying to be done by July. It is summer. We'll see. That's our best guess. And then healthcare services would prepare a check write for sometime in July or early August. And then healthcare services also would prepare a report for SDS to reconcile all the expenses that we've made, or all the issued checks that we've processed. Cashing the check seems like it's such an easy thing because everybody wants money, right? We learned during the CARES Act funding that sometimes people didn't cash the check, or they returned the check, or they decided they didn't want to participate. So this is super important. And the short project timeline requires swift action from all the parties. That's why I say we're really partners in this, because you have to be able to be very responsive as well, so that we can reallocate, have time to figure out how to reallocate money. Providers always have 90 days from issuance of the check to cash it. We wouldn't fool around with going back and forth with you in this particular scenario, because we can't, because of our short timeline for the project. So if we would try to notice you within that 90 days, if we notice you haven't cashed it for some odd reason, 91 days post the issuance, we'll run a report. And if the check is not cash, we'll void it and assume you don't want to participate. It's pretty hard line, but it's what we need to do to keep the project moving forward. We will reallocate all unused funds into the general pool for redistribution. And if a provider returns a check, same thing, we'll issue the notice and we will reallocate that money for distribution in the future to other providers. So the second allocation, so let's say, we get the first allocation out, we're trying to figure out how long would it take us to figure out what the second allocation would be. And that really depends on how fast we get the first check issued, the 90 days afterwards, and then giving ourselves some time to actually do the math and reallocate the second allocation. So again, this timeline, tight, maybe not reasonable. I'm not sure. I'm just putting these in here as target dates, and I'm hoping that we will be able to do this, because I think you can all use the money. I'm pretty sure you can. The notice of the second allocation would then be sent out sometime in January, is what we're thinking. And again, the funds have to be used in the same manner for that same table of what we're going to define the expense categories to be, and that's how we would move it forward. So in this example, I'm going to show you again the difference between Caroline's Irish Care and LeBron's Classic Care. So Caroline had the $147,000 that she didn't spend. She did not give us the attestation form or the application. So we are going to consider her funds for redistribution. LeBron, you remember, also didn't have any spent money during the first base period. But LeBron sent us the application and the attestation and said, yep, I want to participate. So he knows that he's going to have at least $12,000 to give out prospectively, meaning like right now, if he had this information today, he would say, well, I have $12,000 to spend. I could spend it in this month, next month, for this next year. And we recalculate. So what I showed you, I'm tried to make this example pretty clean. So in this particular circumstance, Caroline is going to be removed from the pool because she's not participating. So Caroline's Irish Care, they're out. Their money's redistributed, but then we have to recalculate what the percentages will be, because if we have one or more providers removed from the pool gets smaller. The percentage of total Medicaid claims, your percentage would get bigger, because you're part of that. You're still part of the grand total. Caroline is not. So we would recalculate your percentage. We'd put all the unclaimed and return funds you see in column Q. So right now it's just Caroline's Irish Care for the sake of this, but if there were other provider agencies, or we had adjustments and we could show that, we still had extra money in the fund, those adjustments might go into that column as well. Then we would redo the same methodology to get your total of distribution of funds for the second allocation. This is just the portion of unused, unclaimed funds. What we would then do is add it to your remaining from column M. So in Lynn's place, she had $1,800 left. You might remember that. We're going to add it to the column R, which is her $9,523 of those unused claimed funds redistributed, and then add it up. So her total second allocation is really going to be column M and column R added together. And she will know she has that money to spend going forward. So the tricky part is we wouldn't actually be able to notice you of this second allocation of the redistributed funds until we're able to calculate that. You would know what you hadn't spent, but you wouldn't know what was going to be redistributed until we're able to get that out in probably December, I would say, just based on how much time it takes for people to cash checks, opt in or out, get us their forms, all of those things. I hope that makes sense and I'm not forgetting any part of that. And the last part here for the process is we also, as I mentioned before, have to be able to audit on a randomized sample our provider groups that receive the funds and make sure they spent them correctly. Sometimes we get an investigation that says, hey, they claimed all this money and they didn't spend it. And DSPs report to us, someone reports to us, we would conduct an investigation. If we noticed an overpayment or you self-disclose an overpayment and you have to pay it back, because we then would either have to redistribute it or pay it back, you would have sanction appeal rights under a sanction, and we would then follow the normal course of sanction action if you didn't pay the money back. And that will all be in our process when we distribute that to you. The next steps. So as I said before, based on our information from this particular webinar, and from information I hope that you'll go back and consider with your agencies, we will develop a FAQ, a frequently asked questions. We're hoping to finalize the forms by mid-May, so there'll be some internal process and back and forth. We haven't had a chance to even discuss this with our legal team yet, as far as what needs to be on each form. We would like to host an additional webinar, an instructional webinar on May 26th. So I would come back to you with all the finalized forms, hopefully have your allocation amounts ready to be distributed, and get us on the road for implementing. We would notice providers with the allocation amounts, like I said, by early June at the latest, if all goes well. And then providers begin submitting forms until June 17th. I'm not sure why I picked June 17th. I think it's because in order for us to do a check rate, I needed in July, in the month of July, we needed 30 days to actually look through the forms. And so, again, negotiable depending on how fast you want to get money and how fast we can make it happen. We will be recruiting for a long-term non-perm position to assist with the implementation. So far, honestly, whether this is a good idea or a bad idea, it's kind of been my idea with a lot of help from guidance from work group and an ARPA committee, but I welcome the help. Looking forward to having someone actually help with the details that will be needed for this particular project. And I thought a nice spring picture of a hummingbird would be good to show. We're headed into summer, and we're going to be doing this project all summer, it looks like. So I have also established an ARPA mailbox. So the ARPA mailbox is hss.dsds.arpa@alaska.gov. I also gave you my contact information, but quite frankly, it would be much faster and more efficient if you email the ARPA mailbox, because if I'm out of office or someone else is out of office, we can, or we finally get that long-term non-perm person, we can actually have someone be checking that every day, and we can formulate our responses and our FAQs from that. I think that's it. That's all I have. I'd be happy to open it up to questions. I know that we want to give folks a short break before the next meeting. And so I would open it up for questions. Kara, if you could help me with that, that'd be awesome.
Sure. As I had talked about before, folks are welcome to write your questions into the question area that you can see. You're open that up. If you don't see it, you can open it up. There might be a little arrow where you can open up the question area and you can see it better. Let's see. I will take a look at the ones that came in during this period, this presentation, I should say.
And I apologize if I spoke really rapidly, but get on a roll and I have a hard time slowing myself down a little bit.
Okay. Couple of ones to start with. What if our agency received CARES Act and already gave us and DSPs 4 incentive bonuses for working during COVID? Is this still available for people who received CARES Act funding and already paid bonuses?
That is a very good question. And I honestly don't know the answer to it right now, because what we have, what we put into basically what the rule says is that it can't be used for something that is already been established or supported. So I probably will have to check on that. It's a very good question. I guess I will figure that out and get back to you.
Okay.
Very good question.
As I stated before, feel free to write in your questions, even if we don't get a chance to get to all of them, or we don't, maybe we don't read your question out word for word. Don't worry, it is recorded in our session, so we're able to respond to it through our FAQ and other means. So please continue to write them. Question says, what will happen if Medicaid enrollment revalidation was delayed due to the state's delay in processing enrollment revalidation paperwork? There's a required enrollment period. If somebody was delayed because of state's delay in enrollment, or revalidation, would that affect this?
If there's a delay and you are no longer eligible, you're no longer enrolled, we would have to do those case by case. I will defer to my healthcare services folks to figure out how we would work through that. If it's our delay, then I think we would work to correct that. Would be my best guess answer.
Okay.
But I will find out.
Okay. Thank you. The question says, how many allocations will there be?
Very good question. I think that the money is going to go fast, but that's just me. So we can allocate as many times as we need to up until the close of the spending window. So as I mentioned, we have to expend the funds currently the way it's set up. We have to expend all the funds by March 31st of 2024. We have received word through our national organizations that CMS has considered extending that time period, but we don't have official word on that yet. So I'm hopeful, though, that we could expend all the funds pretty quickly, because we could use that insurgence into our workforce quickly.
Okay.
Mhm.
There's a question here about the overtime being a reimbursement for overtime paid due to pandemic work, overtime work due to pandemic needs is acceptable. How will that be determined? There's an example of DSPs who work different jobs, and one job is one time, and then the next job is OT. How will qualification of OT for that reimbursement be made?
That's a good question, and I'm not sure. I think I probably need some provider or stakeholder assistance in determining what the criteria should be for that.
Okay.
Mm.
I'm just opening up the questions box so I can see
Mhm.
all the words. When are you planning to share the amount approved in the initial allocation?
After the May 26th stakeholder meeting, assuming that we can get all of our forms finalized, and these questions are great questions, honestly. As long as we can think through all of those scenarios and come up with a concrete guidance by then, I would hope that we could give that amount out very soon thereafter. You know, the amount isn't dependent on the forms being finalized, but it takes us a while in the back to look at all the claims and how they came in, and make sure we have all the eligible providers, and we're not, we're not omitting someone. So it's going to take us a bit of time through the month of May. So I would say at the end of May, at some point, we could distribute that.
Okay. Next question says, can increases that providers have needed to give DSPs be allowable for reimbursement?
Increases as far as incentive bonuses and retention bonuses, as long as it meets that requirement, then yes. Pay increases, just regular pay increases, that's not what this is intended for, so no. But incentives to stay at work, yes.
Okay.
Mhm.
What can prospective funds be expended on?
The same exact eligible things that will be in the retrospective amount. So we're not widening the pool at this point in time. We're keeping that exactly the same. So that table that I showed that had exactly, let me show the table again. Sorry for the scrolling. Might be an easier way to do this. I'm going back through my whole thing. Sorry about that. It's based on that table only, and this one. Whoops. Then I scrolled too far. Sorry about that. Back to the sleeping bear. Right here. Those would be retrospective and prospective allocation categories that you can spend money on.
Okay.
And we're trying to keep that fairly limited because, again, it's for a very specific reason, to influx the DSPs with incentives to come into service, remain in service. So
Okay.
go ahead, Kara.
So we're coming up on 1 minute to the top of the hour. Did we want to provide a few minutes break at the top of the hour? And we have time maybe for just one more question?
Sure. Mm-hmm.
Okay. Is there a way to fund individuals who worked as a DSP but did not have the title of DSP? For example, an executive or manager, member of management in an agency who worked as a DSP during COVID to cover? Is it possible to fund those as well?
I would say at this time, they wouldn't be considered, but that doesn't mean, that's a good question that I will definitely bring back to the work group. I wonder though if we would have a hard time validating that. And so, and you would have a hard time as a provider validating that going forward as an audit. Like, so an example, I'm assuming you would pay your executive a salary and then they went and filled in for a DSP that couldn't come into a shift. Their salary is still going to show that they got a salary. It's not going to show that they got the $18 an hour or whatever the DSP would have gotten. So I think it would be difficult to show that. So at this point, I would say that's probably a no, but something we could definitely consider. And I would suggest to that person that asked that question, if you have a specific example or scenario where you think that you could demonstrate it, send that to us in the ARPA mailbox, and we may consider that. And again, here, and for this particular slide that's showing, for all these reimbursement types, if you have particular things that you think support DSPs that we have not considered here, please suggest those. And I would prefer to have those before May 17th. I keep picking the 17th. I'm not sure why. I think I just went May 17th and then everything 17th after that. But please submit those to us, because I think that's where we have to get to a defined list, and I'm happy to include all of those or consider those, not include them all necessarily. I don't want to make any false promises, but definitely we will consider those.
Okay. Thank you so much, Lynn. And our questions keep coming in. Yes, there will be a recording available later, and we'll share. The plan right now is to share the link to the recording by e-alert. So just please make sure and read your e-alerts. And also your questions are going to be used to help form our FAQ. And that is why I encourage you to write them in. It's now 2:02. So if we want to move to our next portion of this presentation during this last hour, folks can take probably a 3-minute break or so, and we'll be forming together at 2:05, if that's okay. Does that sound okay, Lynn?
Yeah, that sounds great to me. As long as Tony's available and everybody's ready, that sounds perfect.
Hang on, Kara, just to be clear, you know, the e-alert said that we would be reconvening for the second portion at 2:40. I hate to have anybody that was planning on joining at that time, you know, find out they're actually half an hour late. So I would propose that we continue to take questions and break closer to 2:30.
Okay, we can do that.
That sounds great.
Yeah, okay. So we'll continue with our questions. And let me find my place here. Okay.
I can't figure out how to make mine bigger, Kara. Otherwise, I would read my own questions, but I can't make it bigger.
That's okay. So, if you want to try, you can go to the little gray bar that says questions, and just click on the little square with the arrow sort of jumping out of it, right, and it should make it bigger.
Gotcha. Got it. Thank you.
And if you want me to read them, I'd be happy to read them. I got down. It's hard to tell because people keep entering them, so it's like you think it's halfway done, but it's not quite done.
Yes, I see that.
Yeah, we got to the one where we were talking about folks who were not DSPs, yet they went to work as a DSP, and that was a good question. Let's see, and you know, we do flag them. I don't know if you can see the little flags. Yes. We flag them green if they were already answered, and they're the last
red
one.
If they were not.
Red if they were questions that we didn't have an answer for at the time. You know, like we'd have to pitch it to another team to take a look at, but we sort of answered it, we addressed it, but you know, we needed to hang on to it for another group of minds to look at, if you will.
So I think I might be able to answer that question. How will providers who complete cost surveys report the ARPA funds? These funds are a one-time allocation. So these are reimbursements. So they're not funds available to spend on anything other than what you've already expended for. I'm not exactly sure how we would account for those in a cost report, but I would say yes, they are a limited, finite amount of money just to reimburse, to re-infuse the workforce. So that would be something I probably would have to get help answering.
And you got it. That was the last, that was the most recent one that we didn't do yet. So the one underneath that one would be the next.
Okay. And I'm not sure I understand that question, the next one. So I'm going to go to, I missed the first 30, so sorry if you already outlined this. For purposes of this funding, who or what are you categorizing as DSPs? Yes, so workers that provide services in the categories of service categories that we listed in Table A. So it would be family hub workers. I mean, I'm not going to go back to the table right now. In fact, do you want me to stop sharing my slides? Would that be easiest? And it is in the presentation, so it's workers that support those services. I hope that answers the question. So another one was, I noticed that overtime paid to DSPs due to the pandemic was acceptable. How does this qualification get determined? Oh, that's the one where we said we would come back to it. And the recording is available later. If we gave DSPs paid leave days, not taking from their bank as self-care days, would that be considered an expense for reimbursement? I would say yes, and I think we probably would have to figure out what category that might fit into, if that would be considered an incentive. I think it's an incentive. So when I look at shift differential payment related to the pandemic, paid leave for DSPs due to COVID needs, vaccination, sickness, quarantine, perhaps that would be a suggestion to add a category that said paid leave for DSPs due to COVID exhaustion or something like that. I would say that we should consider that. So I won't make that promise, but I will definitely bring that back to the group for consideration. Is there any way to fund those executives? We answered that one. Is this for PCA only, or is assisted living involved? And if there are a mix of private pay and Medicaid, but staff work with both, would we still qualify? And if raised base hiring rates to entice employees to work here, is that considered recruitment under these guidelines? So it is not for personal care. It is only for home and community-based service providers, or certified services. If a DSP works in both, I am not sure how we're going to figure out what would be a true expense for that DSP under that service category. And that is something I think we probably need to consider. If they work with a mix of private pay and Medicaid, but staff will both work with both, would we still qualify? Kind of depends on how you paid them. If you needed them as a DSP for your Medicaid eligible services for assisted living home, and you paid them a retention bonus, I would say that would qualify. So just as a comment, it says, This webinar is labeled as a public meeting to seek stakeholder input, but it appears that these plans have already been made, approved, and the purpose is just to explain how agencies will comply. That's a good point. I would say for the sake of timeliness, I tried to put together a very thoughtful plan that would deliver these funds out in a really streamlined and quick manner. We're still open to a lot of feedback from this, but there are certain ways that we have to do business that we will not compromise on. So just to be clear, we're asking for your feedback about these reimbursement types. We're asking for feedback on dates. We're asking for feedback overall on the process itself. But when it comes to an attestation form, that will be a requirement from the state of Alaska. We will not accept, feedback that you don't want to have to do that, for example. So there are certain things that obviously for state process we have to do. And I'm sorry if you feel that it is not open enough, but we definitely welcome feedback and hope that you'll continue to comment. Point of contention, a pay increase is the greatest retention bonus ever created. Yes, it is, but it's a little bit different than what these funds are intended for. And there's a whole process for how we determine what a rate should be. I'm not sure about pay increase, and we could consider, we'll look at that and consider it, but I'm not sure it meets the requirements that we've put forward to the federal government for reimbursement.
Lynn, hey, this is Tony, and I would just add to that that was a constraint that we had from the administration, is that we not use this money to increase pay rates or rates generally, because that would require regulatory change and future commitment from the legislature and the administration when the funding is only time limited. Thanks.
Mm-hmm. And a provider agency agreed. Thanks, Tony, for that. That's sort of our involvement with that. A provider agency, we give you $22 an hour basically for a respite person. You can decide to pay $15 an hour or $17 an hour. That's a business decision that providers make. That's not one that we weigh in on. So it is great to offer more money if you can afford it. Agreed. Statement rather than a question, but we would prefer more time for the application process, even if that delays the payout. Good to note. Someone says, thank you, Lynn, for recognizing how great the need is. I think we all recognize that. What if
Lynn,
Go ahead.
I was just going to say, I would love to hear if other people agree with that, that more application time is more critical than getting the funding out.
Yeah, I think that's important. I would really like people to weigh in on that as well. Another question. Oh, they scrolled, sorry. What is the provider spending deadline? Again, we're reimbursing. So this isn't an allocation that you just freely spend. We're reimbursing for services. So during the base period, it's between 4/1 of 2021 and 3/31 of 2022. During the prospective period, it's from 4/1 of 2022 through 3/31 of 2023. We cannot make a payment out past the end of the spending period for the project, for the ARPA 9817. So we can't make payments past, at this point in time, 4/1 of 2024, 3/31, 2024. So if you want to be eligible for expenses that we're reimbursing you for, I would say we probably would make the cutoff be, at this point in time, December of 2023, so that we could make payment by the cutoff. If that time gets extended officially, we will notice you and let you know that that could be extended further. Somehow I scrolled up, sorry. The presentation will be available. Will you let us know the percentage and amount we are allocated? Yes, we will. That will be in the end of May. Why not widen the pool? DSPS deserve a pay increase. I'm not sure what DSPS is. DSPs deserve a pay increase. And I think we've already explained that we specifically were asked not to consider wage increases. Another question that I thought I tried to answer, why were PCS services not included? Again, because we have a finite amount of money, and we felt like the waiver level of care services were hardest hit because they take a higher level of need. We saw that repeatedly throughout the course of the pandemic. Those are the people we heard from that loud and clear that services could not happen because DSPs were not available and administrators were going in and delivering work in assisted living homes. And so we felt like we had to limit it to that. Again, once, if a provider is a provider of both, let's say I get a reimbursement for my respite service that I qualify under the respite services, and I get a reimbursement because I've provided all my respite providers a bonus. Once I'm reimbursed, that's my money because I've already been reimbursed under these eligible guidelines. I can reinvest that money that I was reimbursed into my personal care provider pool or into my meal provider pool. I, as a business, can make that determination. But for the sake of this particular project, we decided we needed to really limit it down to the finite list of services that were the hardest hit, and make it so that we could reallocate. And we think this money won't go far, as my guess. It's not going to go far. And so we're hoping that it just gets reinvested into the work pool. Will SDS be providing guidance regarding what might be considered an eligible recruitment or retention bonus versus non-eligible standard or expected wage increase? Presumably, a standard or expected wage increase would be an increase provided accordance to an announced agency schedule or another specific DSP level agreement, while a recruitment, keep scrolling out the wrong place, while a recruitment or retention bonus would be a wage increase provided outside of a schedule or agreement for the purposes of encouraging a DSP to join or remain in the caregiving workforce. Correct or no? I would agree with that, yes. Or is wage increase here being used as a stand-in for rate increase? If the latter, please ignore my book. I don't think that we ever intended this to be a rate increase. Like you said before, you would have an established, I'm going to pay someone $16 an hour, and that's going to be forever. They went from $14 to $16. That's forever. That's a rate, a wage increase. That's not what these funds are intended for. But if you said, I'm going to give you $500 to remain because you've been a loyal person and you've been here through the whole pandemic. I'm going to give you $1,000. I'm going to give you $1,500 for remaining here. And it's a one-time thing that would definitely qualify under this particular thing. You gave someone a signing bonus after 4/1. That's the other thing to note. It can't be before 4/1/2021. CMS was very clear with us on that. It can't be prior to this base period. It has to be in the base period. So if you said, "Oh, I'm gonna offer people a $500 signing bonus, just like the Costco's doing," that qualifies for this particular project. I hope that answered your question. Yes, this will be available after today. So I'm hoping I answered the question on the wage raises. We might have to formally write this out in a FAQ just to make sure that we're covering people's questions appropriately. And I'm not the end all be all on this project. I am trying to implement it in a very fast way. So we do have a work group we will go back to and try to run these questions by. They're very good questions, appreciate it. And you're putting them in the question answer, that's great. We'll generate questions from that. You can also generate responses again through the ARPA website or the ARPA email box, the hss.dsds.arpa, A-R-P-A, @alaska.gov. And we will respond and add those types of questions into our FAQs. So appreciate everybody's very vocal feedback. It's appreciated and encouraged. I'm not seeing any more coming in. Kara, do you see more that I'm not seeing?
Um,
I don't think so.
No, there's one that says, could it apply to care coordinators?
It does not at this point in time, no.
And then there was a quick follow-up one. Could a recruitment or retention bonus be spread out over a period of time? For example, a retention bonus of an extra $2 per hour for the next 6 months.
That would be something I would bring to the group to consider, because if you're stating that it is for a recruitment bonus and it is you have a contract, I mean, it's hard to, we know this across the board, it's hard to give something and then take it away, which is why I keep saying these are finite amount of dollars. So I think that we might consider that as a possibility, as long as you're very, very clear and you've been clear that instead of giving someone $1,500, you're giving them an extra increase through this period, and $2 of that is a bonus payment or a retention payment. That might make sense. I probably have to ask the group that and figure that piece out. I'm sort of spitballing here and winging it. So I'm trying to think about it, but also give you some kind of response. Like I definitely know that you all are the experts in how you pay people and how you retain people. But CMS has been also very kind of clear with us, like, when they were very clear on the retention bonus, like you couldn't give a what did they say to me? You can't give a retention bonus if you just hired someone on April 1st. So they wanted us to be more specific. We haven't been more specific yet to say, oh, you have to be retained. You have to be a longstanding employee of 3 years to get a retention bonus. We haven't dialed it in that much, and I don't know if we need to. That would be another thing I'd be very open to getting feedback on. If it's easier for providers, if you have a dialed in expectation, because again, we also have to meet the criteria when we come to audit your records. And so, you know, I'm not trying to be cagey. I'm trying to be like really open, like we would encourage you, if you feel very strongly that something should be dialed in or included, please let us know that.
Great. There's a couple of votes of thanks for putting this all together and to hear the different travails that our different teams, including our provider teams, have gone through. And just thanks to everybody for this plan and all the work that it represents. And then our question that came in just now, could we clarify how overtime will work? The encouragement, the writer says, I'd encourage maximum flexibility in this area since it's so complex and convoluted.
That's a great idea, but when it comes to auditing complex and convoluted situations, it does make it really difficult for you to prove it and for us to prove it. And so, though I understand the need for that, I also understand the need for having a very dialed in approach to this. And I'm really trying to prevent any overpayments from having to be paid back. And for us to have to do that work on the back end for something that was like, it's hard to know if that really meets it, if it doesn't meet it. I just want to be as clear as possible. And we may need help with this. We may have to extend the timeline if it's too complicated and we need stakeholder engagement a little more to vet out some of those scenarios. But appreciate the thought. I know it is complicated, and not trying to make light of what you guys all do. I just think we're trying to make it as simple as possible. So I think we will respond to questions in the Q&A. Again, please submit those. And I think we want to give people a little break between the next presentation, which I hope you all will stay on for. You'll be very happy with that one as well. So, well, not that I know you're happy with this one, but we have good intentions here. So it's all good. We want you to have a little break in between. So I would say let's release for a few minutes. Go on pause.
Sounds great. Thank you, Lynn. And lots of votes of thanks here coming into our question area. Thank you, everybody, for your honest and ready engagement here with this material. We're very appreciative of your willingness to bring forth your stories and the realities that you're facing as we all go through this interesting time together and bringing care and support to the people we serve. Let's go ahead and take a 10-minute break here. We're coming up at up to 2:30. It's like 2 minutes till 2:30. And if I understand what you said, Tony, before, that we'd have our next presentation at 2:40. We'll take a 10-minute break. Okay, awesome. And then just come right back to the session, and we will hear from Lisa Cobble and Betsy Chivers from Center for Human Development Alaska Training Cooperative about some exciting work that's being done regarding DSP training and opportunities. Okay, so we'll come back together at 2:40. Thanks, everybody.
Thank you.
Hey, Kara, can I ask you a question offline?
We're actually in our presentation mode, and we wouldn't be able to go back to practice mode, if that's what you mean.
I'm just wondering if John can be made a presenter.
Yeah, did he join?
I think when he joined, he sent me a text saying he was about to get on if he's not on already.
Yes, we absolutely can. I'll look for him. Okay. I'm not going anywhere. I'm just going quiet here for a little bit.
So we'll give him the opportunity to say whatever he wants to kick off the next session.
Okay, that sounds good. Everybody, we're back again. Um, Welcome back from our break. And this is time for our next presentation. And I have Betsy and Lisa and John with me here. So, and Tony. Um, Welcome, Betsy and Lisa. And John and Tony, I am going to let you do what you would like here for intros. Thank you. Go ahead.
Oh, I'll go ahead. Thanks, Kara, and welcome back, everybody. I hope there's some new faces that have joined us since Lynn's excellent presentation. As Lynn described in her presentation, there are 3 major projects that we're doing with this American Rescue Plan Act funding. And the second largest, after the project that Lynn just described, is the project that Lisa, with Betsy's help, are going to be talking about now. Lisa and Betsy are at the Alaska Training Cooperative. Alaska is really fortunate in that we have a partner in the Alaska Training Cooperative willing to work with us on this project. We're not only fortunate because Lisa and Betsy are so great, but also because the relationship between the state of Alaska and the Alaska Training Cooperative is making it really streamlined for us to work on the funding of this project together. We don't have to go through the typical involved procurement process to make this happen. So this is really helping facilitate making this project come together quickly. And I'm just going to say before I turn it over that the motivation for this project really has come from input that we've received. Some of you have heard some of the input that said that, you know, doing something immediate to shore up our provider base, like Lynn described with our incentive and bonus project, is really important. And it's really great that we are using this funds to sort of shore up that immediate need. But take at least some of that funding and try and change the curve in a more permanent, long-lasting way. And that's what this next project is about. So I'm very excited about this one. John, I'll let you, if you wanted to add anything before we turn it over to Lisa. And Betsy, I wanted to give you an opportunity to say hi. Glad you could join us. Oh, can't hear John. Okay. John's got a mute thing going. All right, well, good. Let's go ahead and turn it over to Lisa and Betsy. Oh.
I apologize. There's my mute buttons going mute and unmute all on its own. But I just want to say thanks and apologize. I was at a hearing. And the hearing just got over, so I did unfortunately miss the first section. But I got here just in time to hear Lisa present on this wonderful project. And I don't want to interrupt because I think what Lisa's going to say is the important stuff. So Lisa, I turn it over to you and thank you.
Well, thank you very much, John and Tony, for that wonderful introduction to this project. Quickly, I'll introduce myself and then I'll ask Betsy to introduce herself, and we will share with everyone what we've been working on diligently since we heard about the wonderful funding coming to the Center for Human Development through SDS and the American Rescue Plan Act funding. So very excited. Again, I'm Lisa Cobble. I'm the training director at the UAA Center for Human Development, and I help support and lead the Alaska Training Cooperative and the Family Services Training Center. Betsy.
I too need to remember to unmute. Works much better. Hi, I'm Betsy Chivers. I'm a training coordinator under Lisa Cobble's fine direction with the Alaska Training Cooperative, UAA, and the Center for Human Development. My focus is workforce, and I must admit that this is a dream come true for me with what we have been given and challenged to create. So back to you, Lisa, and lead on.
Great. Thank you. So the scope of this project is that we are looking at working with senior and disability services through the state of Alaska to really develop and offer a direct support professional certification pilot project. So that's what I'll be talking about today. Next slide, please. So We are so lucky to have in our wonderful United States an actual national alliance for DSP certification process, and that's NADSP. Many of you may have been introduced to this concept through AADD recently with some of their hot topics. We've also had different speakers at the Full Lives Conference through the Center for Human Development on NADSP, the National Alliance of DSP certification. And this seemed like the perfect opportunity to bring Alaska up to a national level with this pilot project. So we are looking at actual national certification levels of our DSPs for DSP level 1, DSP level 2, and DSP level 3 with this project. And I want to kind of explain a little bit about what this certification process is, and then how the funding would be utilized to help agencies and DSPs receive some funds to be retained in this project and to actually get the highest level of certification within the next 2 years. So the certification process consists of 2 areas, and this is the eBadge Academy structure. One is accredited training, and that is where a DSP acquires those skills and knowledges through training. And what I'm so pleased to announce is just this Monday, on April 25th, the training cooperative completed the first step of becoming an accredited training entity under NADSP. And this means that we have been provisionally accredited. So that's step 1 of a 2-step process. But we have started moving forward in this area. The other part of the NADSP certification is that there are 64 competencies and a code of ethics that would be required for DSPs to accomplish certain training expectations in order to move into certification. So one is a training piece and the other is actually a self-assessment around competencies. Next slide, please. So the initial DSP level is the certification, and it consists of 15 badges. What this means is that the training cooperative would be offering a certain number of training to help, hours of training to help someone obtain the badges necessary to move towards DSP level 1. And it comes in the following level of training. So 10 hours, a DSP could earn 1 badge towards the DSP initial level. The next badge is an additional 15 hours. You add that to the 10 hours. So that'd be known as the 25-hour badge. And then an additional 25 hours makes the 50-hour badge. And that would then be the 3 training badges. So a total of 50 hours. Then there is the NADSP Code of Ethics badge and NADSP competencies, 11 badges total, along with the training and the ethics badge, go into the certification for DSP1. Next slide, please. For DSP2 level, advanced level is a 30 badge total. First, the DSP must earn their DSP level 1, which I explained in the previous slide. And this then means 15 badges. That's broken down into 2 more training badges, a 75-hour badge and a 100-hour badge. So you would just add to the DSP level 1 for the level 2, an extra 25 hours and another 25 hours. So 50 more training hours and 13 badges on competencies. Next slide, please. For the highest level, and that is what we really are focusing on for the next 2 years of helping DSPs get to this level is the specialist level. The DSP must have earned their DSP2 badge. There's no other additional required accredited training, but there are an additional 20 badges so that a DSP level 3 specialist would have 100 hours of training from their DSP2 level and a total of 44 out of 64 competencies would be addressed through the self-assessment. Anything that you'd like to add, Betsy, before I move on after this DSP level 1, 2, and 3?
No, I think you covered it quite well. Thanks.
Great. Next slide, please. So what does this mean? Okay, I explained about those 3 levels, but here is an overview of what we are proposing along with SDS partnership to help do a pilot project. So the timeline is over the next 2 fiscal years. We actually started in March of this year, but have not accepted any funding at this point because we wanted to move quickly. It's very difficult to do a small couple month grant or RSA. And so Betsy and myself have dedicated a lot of our time and focus in developing this idea for this 2-year plan. And we have used our training funds from the Mental Health Trust Authority to be able to get things started. So in this planning stage, we'll talk more about that. That's from March 1st through June 30th. And then we're going to move right into the 2-year training project with the first fiscal year 23, 12 months, and approximately $858,000 devoted to this first piece. And then in fiscal year 24, the next 12 months, we are devoting over $2 million, actually $2.5 million towards this project. And we'll talk about incentives because that's where a majority of the funding will be going towards. Next slide, please. So our pilot goal, right? And a pilot means you're trying something out. We would love that we could have every DSP in the state try this out, but we really are looking at how can we be most successful with the investment coming from the ARP funding. So our goal is looking at 175 DSPs earn all the way through in the next 2 years their DSP3 certification and that 50 badge mark. In fiscal year 23, and breaking it down, the cohort of 175 DSPs would complete their 100 hours of training. And we would be, the Alaska Training Cooperative, offering this training for free to this cohort to be able to earn the training badges necessary for certification. Then in fiscal year 24, the cohort of 175 DSPs would complete, with support from the training cooperative, the 44 badges necessary to be able to earn their DSP certification. So we have ambitious goals coming up for the next 2 years. Next slide, please. So you might be saying, well, Lisa, this is lovely, but can you explain the plan? So the plan is we've been working on this pilot project, and we started that in March and working through this. And part of this is to get some feedback and to answer some questions because we can't do it in a black box. So we've been developing the plan. And the first part was to complete the NADSP accreditation form section 1 that I mentioned, which is the provincial accreditation approval, which we just got. So we submitted that step 1. We submitted the fee that was covered by training cooperative funds, And part of what we have to do in adhering to this approval is start with an advisory council of stakeholders. And so we're in the process of looking at recruiting advisory council members and going forward with that as soon as possible in May. Again, I mentioned we got the preliminary accreditation approval. So our trainings can be accepted by the NADSP for certification. Our next step is that we have to come up with a way to have an application with agencies and DSPs for filling the 175 seats in the pilot project. And we're in that process as well. Then we need to choose the DSP cohort, and then we would be drafting agency contracts for incentive process. An independent DSP in this pilot, we're not able to honor that at this point. It must be through an agency process. Anything that you'd like to add at this point, Betsy? All right, next slide, please. And I'm going to take a quick sip of water. Some of you may have noticed I sound a little foggy. I have a little bit of a head cold, and so my mouth gets very dry quickly. Excuse me. So implementation for our very first year, and this would be fiscal year 23 coming up starting on July 1st. We would complete then the next section for full accreditation as a training entity under the NADSP. And we have a certain amount of time to complete that now that we have the preliminary accreditation. The goal is by October 31st. That's like the drop dead date. Betsy and I are already working on this form, so we are very optimistic that we will meet this deadline way before October 31st, but that's part of the plan, is to have this timeline mapped out. We also have to negotiate the cost for 175 DSP seats with the National Alliance on Direct Service Professionals. And that's about approximately $15,000 annually that will be devoted in the next 2 years towards this accreditation process, that DSP certification. We will then be offering the approved trainings for the 10 hours, the 25 hours, the 50 hours, and actually 75 and 100 hours to have everyone be ready to go for certification. You might be saying, well, Lisa, how many hours does this mean for a DSP? We have estimated that a DSP would need to attend an average of 8.5 hours of training monthly in fiscal year 23 to reach the 100-hour level. And this could be face-to-face, it could be, distance now, as well as we do have some anytime trainings that can be offered that we are hoping will be absolutely accredited by NADSP. So we already have working on a training matrix. Then on fiscal year 23, we also have incentives for contracted agencies and DSPs that I will explain. Next slide. So I think this is one of the most exciting pieces. You know, you have to think, what is a carrot or motivation for an agency to have their DSP maybe become part of this pilot project? And then what is motivating for the DSP to do the training parts, right? So we developed this incentive matrix. For that DSP that's been accepted into the pilot project under their agency, when they earn their first 10-hour training badge, they would receive $100 and the agency would receive $100. When the DSP earns their next badge for 25 hours of training, which is 15 hours added to the 10 hours they've already completed, the DSP receives $200 and the agency receives $200. So you can kind of see how this is building. When the DSP earns their 50-hour badge, there is the incentive of an additional $300. The agency receives an additional $300. Moving forward to the 75-hour training badge, the DSP would receive $400. The agency would receive $400. Up to the 100-hour training badge, the DSP receives dollars, and the agency receives $500. So after that 1-year investment of time in training, the DSP incentive is they would earn a total of $1,500, and the agency would earn $1,500 for that DSP in this project. Betsy, anything you want to add?
Woohoo! That's all.
All right, next slide, please. So going forward then into fiscal year 24, that would start on July 1st of 2023, about a year from now, we have an incentives plan then for the DSP to go through the certification levels by completing the 44 total competency badges. So the DSP would earn DSP level 1. They have their accredited training finished. They do the 11 competency badges. The DSP receives $1,000 and the agency receives $1,000. The DSP continues forward, earns DSP level 2. That's 13 additional competency badges. The DSP then receives $2,000 once they get that DSP level 2 through NADSP. The agency receives $2,000. And then the final piece is that specialist level, DSP level 3, 20 additional competency badges. The DSP earns $3,000 and the agency receives $3,000. So in year 2, the DSP has an opportunity to not only get their DSP 3 level of certification, but to earn $6,000. And the agency in supporting this DSP would earn $6,000 once that DSP has gotten their DSP level 3 certification. Next slide, please. So the total incentives for a maximum of 24 months in this pilot project would be each DSP receives $7,500 total and their DSP 3 specialist certification, and the agency receives $7,500 total for staff DSP who completes. The idea is that the agency can have those funds in being able to maybe cover a DSP shift when that person needs to do training, to be able to backfill if a supervisor needs to cover a shift. But this is an opportunity then for incentives for both the agency and the DSP so that there is success in this pilot. Next slide, please. So that was pretty quick, but we wanted to kind of introduce this idea of this incentive program. This is information for both context for myself and for Betsy. Betsy is the lead training coordinator on this project, and this was hopefully, and I was able to express this in a way that was understandable. So I think it's time for some questions.
Sure. Thank you again for this wonderful presentation. And I'm prepared to share questions and comments that have come into our chat area. Once again, please feel free to enter your questions about this presentation related to DSP training. And if we can get to all of them, we will. And if we can't get to all of them, don't worry, because they're recorded in writing for us, so we can add that to our FAQs and use it for our future outreach. So lots of comments that say it's very exciting, lots of comments of thanks and compliments about it being a fabulous plan and the work that has gone into it already. And so our first question is, will there come a time that only certified DSPs can provide home and community-based services?
And I think that would be a question more directed toward senior disability services. There's no plan at this time, certainly, for that to occur. Will there ever come a time? I don't know. But that's nothing that's on the drawing board here at SDS.
Okay, thank you. So a few questions here about the advisory council. Can we learn more about what we're looking for with the advisory council?
We are in the process of developing this advisory council with Senior Disability Services leadership and with Kara. We are looking for stakeholders. We'll be doing some specific outreach, for example, to AADD, to AgeNet, to the Alaska Commission on Aging. We feel that they are important stakeholders that we would like to invite on the council. The Alaska Mental Health Trust Authority, Eric Boyer in particular, who is a program officer where workforce is his expertise area, and then some other stakeholder groups. Again, we want to do outreach to the Alaska Alliance of DSPs. So we're still in the formation, but we hope to have more information on this very soon.
Okay, thank you. Question says, how many hours of total training is this, including the competencies?
Well, that's a really great question. It's 100 hours of accredited training. That is very clear in the NADSP certification process. The challenge is for those 44 competencies, it's a self-assessment process. So the competency badges are earned by the DSP identifying one of the competencies and addressing the skill and knowledge areas of the competency. For example, there would be a scenario that the DSP would write up and share then what skills they learned, how did they address that competency in their scenario, and then that gets submitted to NADSP, and they are the ones who make the final determination. The training cooperative does not make that determination. However, we would help support that DSP in this project to be able to write the very best scenario and help them figure out how to best express the skills and knowledge that they demonstrated. So it could be something that takes 15 minutes. It could be something that takes longer in that DSP identifying how they've met that competency area.
Okay. What about DSPs who've already completed training previously from an NADSP accredited organization like Relias? Can they submit this for credit?
In the pilot project, if we have a DSP that's coming from an agency that has already completed certain training areas, yes, there is a grandfathering aspect to the NADSP process. Ideally, we are hoping that the DSP will have completed some of the training cooperatives training, because that can also be grandfathered in. But we would need to look at this case by case, but that is part of the NADSP process, is if you are an accredited training entity, and Relias is one of them, there are trainings that could be submitted towards this certification project. The DSP and the agency have to be accepted into this project. That's the key for Alaska right now.
Okay. And is this a cohort and just one cohort of 175 DSPs?
You know, we've been working on this puzzle. Betsy and I have spent a lot of hours. We will have a better outline of the cohort process here soon. We understand that DSPs may be accepted into this project and then may leave in the first 6 months. So we're looking at some contingencies. So a DSP leaves in the first 6 months, there will be a window of time when another DSP can be accepted, but the incentive project piece will change because we only have a set amount of money for 175 DSPs to complete. So my short answer is more to come on this, but there will be some contingencies with cohort 1, cohort 2, and cohort 3, because we understand that not everybody is going to be able to do exactly everything with cohort 1. So more to come is the short answer to this.
Okay, thank you. Thought shared here, it says it seems to be added cost to the agencies and not enough reimbursement. DSP training for 10 hours where we still have to pay their wage. For someone making 17, it's 170 in training for 10 hours. Once they're done with trainings, they have a certificate and should be making $25 an hour. Seems like a lot of administration overhead for this. What can a DSP 3 do that they can't do now without the certification?
I'm not sure where the calculation came in that there's an expectation that the agency has to pay a higher rate. That would be the agency's decision. The agency and the DSP do not have to pay for any of the training that is being offered through this. And the incentive is to help offset costs. I don't think there's any way that a project could be 100% offsetting costs. But it looks like Tony might have an answer to this as well.
Well, just those are great. Those are great comments, Lisa. And I just wanted to add a little bit. What else do they get? I mean, the worker gets a transferable certification that is useful to have on a national level. That's one thing they get. The agency also gets a better trained, more competent DSP. But you know, this is a great question, to be clear. And it points out the sort of the line that we're trying to walk with this pilot project. 175 DSPs. One of the things we're eager to hear from all of you is, do you think we'll have trouble filling that cohort? Do you think that's not nearly enough people for a cohort? Because if we wanted to increase the cohort, then we'd have to reduce the incentive. Or if we wanted to increase the incentive, then maybe we're going to come down to 100 DSPs that would be eligible for this. So that's one of the things that we were hoping to gather today, was a little bit of input on the pilot numbers that we put together. So I just wanted to add that.
Mm-hmm. Thank you. When will applications be available for agencies to apply for their DSPs, or how would they fill them out themselves? How will people be made access to this, given access to this?
So we are, that's one of the next steps that we're doing, is developing the application process. I'm sure with SDS, this would go out on SDS alerts. We would do the Alaska Training Cooperative constant contact list. We would do all sorts of outreach through different stakeholder groups. So ideally, we are hoping to get that application out in late May, early June. So as you can imagine, we are going as fast as we can. I heard Lynn mention something about she's kind of, with her project, going as fast as she can, because this has a very sort of quick startup that we are working on. So that's where we are at in that plan.
Okay, thank you. A couple of questions in the theme of ongoing funding. Is it the hope that if the program is successful, it may become regularly funded to encourage this ongoing higher level of trainings? Thoughts on that?
I'll go ahead and I'll start, and then I don't know if Tony might want to add. When I shared with Eric Boyer at the Alaska Mental Health Trust Authority that this wonderful project was coming to be, one of the things that I would like to help advocate with our trust funding that we get through the Alaska Training Cooperative is an ongoing dedication to helping to support in some way the certification process. I know that I have heard from agencies for my tenure as director and as a trainer myself at the Center for Human Development that training costs are just such a burden at times. My hope is that the trust would continue to fund the training cooperative in this endeavor, and that we could offer, very low cost to free training is one of the advocacies that I would like to do with Eric and the trustees, so that we can continue this. We've worked so hard to start with a pilot and then be able to continue with support. Again, I'm not saying incentives, but I'm definitely saying something about free training and helping that move forward for our DSP workforce.
And Lisa, if I could, yeah, I think you're absolutely spot on, and that's why we've been in dialogue with the trust and others. But backing up, the intent of these ARPA projects are, this one's a pilot, to pilot this concept, and we're hoping that this show is very fruitful and productive. Agencies like it. We hope DSPs like it, and there's enough lessons learned from this pilot that we would better understand what the costs are, the dropout rates of the program, how many people successfully complete it, how agencies see this, so we could, again, if everything works out well, there's an opportunity to partner with the trust and others to because we would have the data at that point to argue, the merits of the program and with a good understanding of what the costs are and the benefits of the program. And so, it's certainly our intent to see this project be, one, successful, and two, that we could work with our partners to figure out a way to sustain it.
And if I could add, excuse me, Kara, the Center for Human Development, part of the funding coming from this project is to do a research, very focused project in mapping this and collecting data, as John mentioned, around the success and value of what it means to have DSPs trained. So there is a research component that would be coming through the Center for Human Development, through our research team and the university. So this isn't just a pilot on training, there's also a research component so that we can look at the end of this, what value there is so that we can continue. So I forgot to mention that earlier. It isn't just the training cooperative show, but the Center for Human Development will be adding a research component to this as well.
Okay, great, thank you. Next question says, do agencies need to be members of NADSP in order to engage?
That's the great thing about, I mentioned those seats. We're looking at the 175 seats. You do not have to be a member of NADSP. That is covered by this project for those DSPs. So that's another cost reduction. The agency does not have to become a member.
Okay, thank you. Question says, does this replace Alaska core competencies? Would it be appropriate for assisted living? The core competencies seem more appropriate for people working directly with clients in their homes, such as PCA, versus in an assisted living home.
So that's a really great question. The NADSP competencies have been crosswalked with the Centers for Medicare and Medicaid Services competencies, and we will also be crosswalking our Alaska core competencies because they are so similar. That was one of the most amazing things, is when we looked at those core competencies and the Alaska core competencies, they just use a little bit of different language, but almost everything that we've seen that is covered in NADSP and the CMS competencies is covered by the Alaska core competencies. So it's a nice crosswalk. We will be following the NADSP certification process. So it will be specifically their competencies that the badges will be earned, but we will be able to crosswalk all of our training, the training cooperatives trainings, and where they fit with the competencies for NADSP and the Alaska core competencies, because it's a nice, easy fit. And people who have already completed the core competency training for Alaska, if you go into the certification process in the future, once we become fully accredited, those core competency trainings that you've completed will and could be used for future training badges because we are accredited. So that's great for future people who may not be part of the project. Those training hours could be used towards a certification in the future.
Thank you. There's a couple of comments along the lines of support for this idea and DSP national certification, and then some suggestions about reimbursed rates in the future to include this as a cost factor that should be added to reimbursement rate basing, and generally regarding this as a positive effort for quality and increasing training for DSPs. There is a question that says, what are the percentages anticipated of distance or asynchronous training versus on-site or in-person training, live facilitated online? Is there a portion of training that could be done while at work or after recipients are asleep or other downtimes?
Betsy, would you like to take a
I'll take a jab at it. It is kind of my responsibility to really try to coordinate what that's going to look like. The majority of our training has been delivered either via Zoom since the COVID. And we do have some that is available on demand. So the on demand, of course, will be easy. Developing appropriate training schedules, accommodating the wide range of DSP, scheduled work hours, and making sure that there is enough training provided at various times that can accommodate everybody's needs is what we are focused and going to strive for.
And if I may add, there was some feedback that I heard recently that instead of trying to do 2-hour blocks or 3-hour blocks or an hour here or there, some stakeholders have expressed that having training like on one day for an 8-hour day is much easier to cover than trying to cover portions of a shift. So that kind of feedback would be really helpful for Betsy and myself. You see our emails there. Please feel free to, say, yay, Lisa, yes, well, that makes sense for us. Or no, Betsy, that doesn't make sense for us. But this is really where your feedback is going to be very, very important. But the majority of our training will be done in a distance format because we feel very strongly about that interaction that happens with DSPs and being able to, in adult learning, share in a group format, especially around discussions about how do you implement a skill or knowledge. But we will have a portion that is an anytime training, as Betsy mentioned.
Hey, Kara. This is Tony, and I'd be happy to just make a comment on the rates question that's I see in the Q&A a couple of times. We have certainly heard from people, especially the good folks at AADSP, that would be the ideal, wouldn't it? Is if we could link higher levels of certification to higher rates of pay, higher rates for individuals or agencies. And as with the project Lynn described, that was just too big a mountain to climb for the time limited funding that we have here, along with the constraints that we receive from CMS and the administration and others. So what we asked the Alaska Training Cooperative to do was come up with an out-of-the-box way that we could still find, that we could still pass an incentive along to the DSP, and that would make it appealing for the agencies to encourage people to get the training. And I just really commend Betsy and Lisa for this sort of out-of-the-box innovative solution of creating an incentive structure that comes as close as we could to increasing rates of pay without having to go through a regulatory change and all of those things that would have taken a long time to get off the ground. So I just wanted to comment on the issue of linking the certification to rates.
Thank you. A couple other thoughts that folks have shared. Suggestion that the advisory council would include more than just one DSP. People who provide the service are extremely valuable in the role of an advisory council member.
And they are
Go ahead.
included. We do have them represented, as well as peers receiving services, just as a side note too.
Okay, question: if a DSP gets credit for core competencies they have taken in the past, do they still get the incentive payments?
We'll get back to you on that. That's part of our cohort piece. And great question, because these are things that we've been looking at.
People are thinking about it.
I don't have a full answer for you.
Okay.
Yes.
Again, I encourage you to please put in your questions and thoughts, even if we don't have the fully, rounded answer right now. It's really good for us to know what you're thinking about, and it helps us as we plan with the different teams to put this all together. Okay, a question says, will there be an opportunity for a DSP to complete the training in less than 2 years, or must they commit fully to 2 years?
Another great question. Because of the incentive process and how the funds would have to run through the university through a contract, we would need to keep it in this 2-year process, also for tracking and for data collection. So the commitment would be ideally for 2 years for the pilot. Now, a DSP could complete it sooner and then still be part of the project in the second year, potentially. But the idea is that we have to do things in a certain way in contracts each fiscal year with the DSP and with the agency.
Okay. How many DSPs are allowed per agency?
That's
another great question. We have 175 seats potentially, and how many agencies are going to step up and want to participate? And that, it's right now, I would say we just are not sure. We want 175 for sure, unless recommended otherwise.
Other questions? That was the one at the bottom of my list here.
Mm-hmm.
And this is John again. Such great questions, and we learned so much from the questions. And yeah, it's our hope that we have such demand for this, and agencies and DSPs wanting to participate, that it becomes a really hard process to narrow it down to which 175 are participating. And that would be a good start to the this pilot, to have that much demand. So, but great questions.
Yeah.
Thoughts on the composition of applicants to participate? If you get more than 175, I would request optimum distribution between different agency providers. Other thoughts, I would hope there would be diverse representation in the 175 cohort, like new DSPs, veterans, rural, urban.
Great thought.
Yeah. Question says, how many DSPs are certified as a DSP3 in the United States?
That's a great question. And if you're saying certified through the NADSP, I'm sure we could ask that question and get that back to you.
Couple thoughts of thanks and anticipation and great work. So question says, what do we do? Do we just wait now for next steps? Is there anything you would want from us to help the process along?
Well, my thought is your response or suggestions as these things have been coming in, that would be great. Part of it is kind of waiting, because literally Betsy and I are meeting daily. We're meeting weekly with SDS leadership and with Kara as the SDS training director. We're not doing this in a black box. We're constantly talking and thinking about it and developing as quickly as we can. With great excitement, I want to share that with you. For those of you who have worked with the training cooperative all these years, this has been a dream of ours to figure out how to bring certification and that professionalizing of the DSP workforce. So we, can hardly sleep at night. We are so excited about getting this going and how we can make things happen here for our DSP workforce. So please, share. It is kind of sit and wait, because things are being developed literally day by day. And as we can move forward, we will get the word out, and SDS will, share with you as we get these forms and things moving. It's since I heard about this and met with Tony and John and Kara and others, we have just been pushing daily on figuring out these next steps.
Yeah, and again, thank you. And if the reason why we're having these forums is to get feedback, and so we also would encourage you, if you have thoughts after this, the sooner you get it to us, the better. Let us know your thoughts. But this particular pilot, when we were doing our public outreach, a year ago, this was one of the central themes, was to do this, and we met with AA DSP as they were forming as an organization. This was really important to them as well, and that kind of, I think, reinforced that this was I think a worthy pilot to do, because at the end of the day, as the state of Alaska is also going through a technical assistance to become more person-centered as a system, at the end of the day, the tip of the spear, I come from the military, so a military term, the tip of the spear, so to speak, our work is the workforce, the direct support professionals. And if whatever we could do to enable them to be successful, to be respected and valued as a profession, these are steps in that direction to really honor and to recognize and provide this level of support to the tip of our spear. Because no matter what we do in person-centeredness, the execution of person-centeredness is the DSP that are putting hands on Alaskans and providing the supports that are person-centered. And to me, this is a recognition of the long time coming of professionalizing and offering our direct support professionals this opportunity to advance it the discipline as a profession and being recognized as a profession. I think this is, to me, this is really, really exciting. That could, I think, have significant long-term benefits for the state of Alaska, our direct support professionals, again, at the end of the day, for the Alaskans that we support.
Thank you. Just a few more thoughts coming in. The comment says, certification is great. An associate's degree would be another great aim to take in the future. And then some thoughts about making it mandatory to provide services versus incentivizing. This comment favors incentivizing as opposed to making it mandatory because it seems more supportive to a struggling workforce. Mm-hmm.
Yeah, just to repeat that question. That question was asked earlier. I'm not sure if Michelle had asked it earlier or if or maybe if she did, she didn't get to hear the response. There is no plan right now. There is no plan on SDS's current drawing board to have a certification required to deliver HCBS services. There's a great thought by Tyler. You're absolutely right, Tyler, that this is not the time to do something like that. And we've chosen the carrot as opposed to the stick. So thanks for those comments.
And then a question came that's, sorry, go ahead. Did you want to go?
I was just going to say, all the national statistics say that a better trained workforce is a more stable workforce. So in having been a DSP, having worked those hours, this is a great beginning to stabilize a workforce by providing great training and certification on a national level that you can take anywhere in the United States with, a certification of completed training. And those who are dedicated in this workforce can go for the accreditation with an associate's degree or a bachelor's degree, which was my journey. But statistically speaking, most individuals providing that direct support are individuals who just enjoy not necessarily pursuing that academic degree. And this is a way for them to get, again, the best training and national recognition for the work that they do.
Thank you, Betsy.
Yeah, when I met with AADSP, and this is from, I've heard this from other professionals who have certification. It's viewed more as professional development and continuing education versus training. I know that our DSPs are trained by agencies and they've gone through a lot of training. So I view this as professional development, continuing education that leads to certification and recognition of the fact that these are indeed professionals who've earned through the certification the right to be called a professional because they've earned it through their continuing education and their dedication and commitment to go through this particular process. And I think that's what makes the certification valuable, is that people honor it as a significant achievement and a sign that indeed you've reached the benchmarks that you could hang the shingle up. I am a professional. And this, if you go into a doctor's office, a dentist's office, a therapist's office, they'll have their certifications and things up on the wall, and this is something you could have up on your wall too. So this is continuing education and professional development that leads to certification.
Excellently put.
Question says, would this possibly translate into college credit for any type of human services degree?
At this point, the answer would be no. There have been several different projects and programs that have looked at how to move things into an academic career ladder. but this pilot at this time is very succinct, and it's meant for the DSP, National Alliance of DSP certification. In the future, there might be other projects and things to be considered. At the university, there's something called an occupational endorsement. That's less than a degree, but it leads to a type of certificate that might be something that we could look forward in the future. But for this project, we needed to keep some boundaries around it so we could get data and look at how this would be valuable, because that was a question that SDS asked us early on, is how could we maybe put this into an academic format, and that would be a whole nother project. But there's possibilities, is I hope that you're hearing that for future.
The question says, does this credit transfer from one place to another because it is national? Can the certification go from one state to another?
The certification from the National Alliance of Direct Support Professionals is a national certification that is recognized in all 50 states. We, the Alaska Training Cooperative, as an accredited institute, all of our accredited training will apply as all the other national training entities that current agencies are using that have applied through NADSP.
And there's a question regarding care coordinators. If we are certifying DSPs, will we get care coordinators credentialed at some point?
That's a great question. You know, this is about our direct support professionals, and so whether or not this leads to something for care coordinators or others, you know, that's not our intent with this. Our intent is to focus on our direct support professionals with this pilot as a model of how we move towards the future for our direct support professionals. And so I don't think it leads to or precludes work in other areas, but this is focused on our direct support professionals.
Thank you. And lots of comments of thanks, and also thoughts about how important and valuable our DSP's work is, and the DSP them as a person and a role. It's time to start looking at it as a professional career instead of just another job. Are there more thoughts that you'd like to share in our text question area? That was the last one.
Again, I'll say the feedback or the lack of feedback on the split between the size of the incentives and the number of people in the cohort. Not too much comment on that. So I know Lisa and Betsy, we gave this some real serious, thought what the right balance was. So I think that what you've said about wanting to make sure that the incentive is big enough that people really want to do it and complete it, see it through, is important. So I like to think that so no strong feelings on that indicates that we may have struck that balance. So.
And a comment has a shout out to NADSP. The commenter wants to share that membership to NADSP is a great way to get training and be part of a national organization that supports DSPs. There are only 2 agencies within Alaska that are members. It's a really wonderful organization and is professionalizing DSPs.
I couldn't agree more. Well said.
And a comment says it would be a good idea to adjust the incentives based on the number of applicants on the off chance that less than 175 apply.
Thank you for that comment, Tyler. Appreciate that. Another thought related to, you know, what now? What do we do if we're out here and interested to see more? I think Betsy and Lisa, one of the first things that's going to be happening is convening the advisory council. We want to get that group meeting within a few weeks. So while we checked with our Department of Law to see what sort of requirements around public noticing and so on would be, and because this is an advisory group that's not setting policy so much as helping us guide our project, it's not subject to those sort of public meeting requirements. Nevertheless, I know Lisa and Betsy and I have talked about wanting this to be as transparent and open a group as possible. So so look out for further on that.
Okay. It looks like our thoughts and comments here have slowed down a bit. It's coming up on 4:15, and we can keep our session and our comments open. Folks are saying thank you, very informative. Would we be open to ending our session if our audience is finished commenting? Lots of thank yous, lots of it's very exciting.
Yeah, I certainly love hearing those positive, all the comments, you know, and certainly the positive comments. But one, I just want to thank everybody for participating. You know, Lisa, Betsy, and Tony for really taking the leadership role in this particular pilot, and of course, Lynn. And unfortunately, I was at a hearing and missed Lynn's presentation, but I'll go back and listen to it to make sure I hear all those questions and hear all those comments. But this is an exciting time. A lot of work is in front of us on this. A lot of work has already happened. You know, behind the scenes. And so I really think that we've got some great projects. And you know, again, the projects were chosen based on input from Alaskans and providers and recipients in Alaska on what they thought was best, you know, the best use of these funds. And from what I'm hearing, it sounds like it's resonating well. And these, you know, these projects that we're implementing will indeed move Alaska forward and help sustain, enhance, and grow our home and community-based settings in Alaska. And to me, it's just an exciting time and an exciting process to be part of. And I just want to say thank you to everyone who participated in the webinar and offered all their comments and thoughts on making these programs better. So thank you.
Thanks, John. All right.
And we can go ahead and wrap up. Carrie, is there any closing comments or any administrative notes you need to make as we log off? All right.
We will make the as with the earlier presentation, we intend to make this available online. Okay. It's been a long afternoon, but we appreciate everybody who's stuck with us.
Okay, sounds great. Well, thanks everyone again.
Tara, for supporting us through all of this. We appreciate you.
Sure. And thanks everybody for listening and being such an active part of our work here together. We'll go ahead and close our session and just keep your eyes and ears open for our link to be shared for the recording and future communication through FAQ and other means. We appreciate your partnership with us, and we're glad that you're here for this exciting news. We look forward to working together with everyone, and have a great afternoon, everybody. And thanks again.
Bye.
Goodbye for now.
Goodbye.